Good day, classmates. I'm PhD and student Ferdinand Catungal reporting for my part curriculum. Pardon, doctor, I don't have camera for now because camera was damaged. So my report is about curriculum, nursing curriculum development, organizing and framework, and how do we do this curriculum in our settings. So objective is to identify essential nursing competencies required for safe, ethical, and effective professional practice, aligning curriculum outcomes with national and international nursing education standards, and also ensuring graduates are prepared to meet healthcare demands. Develop a structure framework that links learning outcomes with teaching strategies, clinical practice, and assessment methods. Ensure learner-centered education focusing on knowledge application, clinical skills mastery, and professional attitudes. And lastly, is to promote lifelong learning and adaptability, enabling nurses to respond to evolving healthcare challenges, technologies, and patients' needs. Okay, and this is a picture of designing a competency-based and outcome-based nursing curriculum, wherein uh, it uses a circular framework to highlight the key consideration for educational institution when adopting CBNE or the competency-based nursing, and at the same time our OBE or the outcome-based nursing. The main components in this framework is your curriculum designs, the upper portion, where you can see the foundation of the CBNE and the OBE. Sorry for that. Next is uh, the curriculum design is the foundation of CBNE and OBE. Uh, may I repeating my statement and focuses on aligning competencies also and outcomes with course content, clinical practice, and institutional vision. Okay. In a on your right side, the assessment strategies, it must move beyond written exams, which includes your OSCs, the checklist rubrics, our portfolios, the clinical evaluation, and the capstone projects. So the next one is the in assessment strategies. It also ensures outcomes are measurable and performance based. Okay. The next item is the faculty training on the lower side of the right frame, wherein educators need to be trained in student-centered teaching and competency-based assessment methods. And faculty development is essential for successful implementation. So on the lower part of at the right side of your screen, you can see the student support. It's also a vital factor because it provides academic advising, mentoring, and counseling and feedback. You also, in a student support, it helps also the students transition into a competency-based system where mastery, not just sitting at time, is required. The next is your technology integration, wherein one of the newest part of our curriculum, use of simulation labs, e-learning platforms, digital portfolios, and virtual case scenarios. Wherein we already started that one here in San Pedro 2 to 3 years ago. It also, the technology integration can also enhance practice opportunities and prepare students for tech-driven healthcare. As we all know, AI is very, very helpful nowadays in hospital administration. So the next is your quality assurance, wherein it continues monitoring and evaluation of our curriculum and ensuring that teaching, learning, and outcomes meet accreditation standards and healthcare needs. The next item of the circular presentation is the collaboration with industry. Our partners hospital is very important, the clinics, the healthcare organization also. And And it ensures nursing education is relevant to real-world practice and workforce demands. The last one is our purpose of the purpose of the framework is to show that designing a CBNE or OB curriculum requires holistic approach. Success depends not just on curriculum content, but also the assessment of our faculty, student support, technology, quality, and industry collaboration. That ensures that graduates are competent, practice ready, and aligned with healthcare expectations. Curriculum design is I will walk through the framework and the step-by-step process of creating our curriculum that ensures graduates are competent, compassionate, and ready to meet the demands of the healthcare system. So the definition of a curriculum is more than a list of topics. It represents the teacher's philosophy of education and the institution's vision of for students' learning. It also includes not just what it taught, but also the values, attitude, and learning experiences that shape student growth. It it may be a long journey in developing these kind of traits. A strong curriculum aids to equip students with knowledge, skills, and values that prepare them for citizenship, lifelong learning, and professional success. So once you graduate, you have to continue bringing up this kind of trade. Okay, so curriculum design key principles. So it is a well-designed curriculum should be balanced. You know, if you can see here, in balance, it promotes intellectual, moral, spiritual, aesthetic, creative, and emotional and physical development as equally important. All of the items should be equally important. It is rigorous, seeks to develop into disciplinary habits of mind. The subject matter is taught in a way that it is faithful to its discipline. So it's strict, very strict. Coherent. Coherent in a way it makes explicit connection and links between the different subject experiences encountered during the course. Okay? It is also vertically integrated. It focuses on progression by carefully sequencing knowledge. Now provides clarity about what getting better at the subject means. Okay, so looks to avoid appropriate also is a key principle. Looks to avoid making unreasonable demands by matching level of challenges to a pupil's current level of maturity. And focus seeks to keep the curriculum manageable by teaching the most important knowledge. And at the last key principle is it should be relevant. It seeks to connect the value outcomes of the curriculum. Okay? So defining the vision and philosophy is the first step in designing curriculum, nursing curriculum. So you have to define the vision and philosophy. The vision and philosophy should be aligned with instructions, missions, visions, and philosophy. The curriculum should reflect the overall mission and vision of the university and nursing school. Example, if the institution values community service, the curriculum should integrate community health nursing and outreach program. That's why in San Pedro College, we have our CAS because we are aligning also our curriculum in services to the community. Number two is the clarity of the role of the nurses to be produced. What is the type of nurses that we're producing? The program must clearly state what type of nurse graduates it aims. So provide example. Graduates could be trained to be generalist nursing, providing holistic care. Specialists in areas like critical care, community health, or education. So there are many roles of being a nurse. Leaders and advocates for healthcare improvement. The third one is to emphasize the core values. Okay, competence, compassion, leadership, and lifelong learning competencies. It ensures graduates are skilled and knowledgeable to provide safe, evidence-based care. Compassion, fostering empathy and humanistic values in patients' care, not only the sympathy. Leadership, it prepares the nurses to take on leadership roles in healthcare system. And it is a lifelong learning because it encourages continuous education, adaptation to the new healthcare challenges and technologies. The purpose of this step is at the start, the curriculum will have a clear direction and foundation. This ensures that teaching strategies, clinical training, and evaluation methods all contribute to producing the kind of nurse the institution envisions. Okay? So identify core competencies. Use national international competencies framework. Example, safe and quality care, communication, ethical and legal responsibilities, understanding and applying ethical principles and legal standards in all nursing practices, leadership and management, wherein there are skills in delegation. As a leader, you should know how to delegate, and decision making is vital. Supervising teams and managing healthcare resources. Research and evidence-based practice, using research findings to improve patients' outcome. Ability to critique studies and apply evidence in clinical decision making. And collaboration and network of teamwork, working effectively with other healthcare professionals, promoting interdisciplinary care, and respecting diverse roles. So, next slide. To translate competencies into program outcomes. So we have to translate competencies and program outcomes. Define what graduates should be able to do. Example, apply evidence-based knowledge in holistic care. Okay? So students are actually perform upon graduation. Outcomes guide teaching, assessment, and curriculum evaluation. So demonstrate critical thinking in decision making. Ability to analyze patient situation, make sound judgment in every situation, and choose appropriate intervention to patients who are in need of our interventions. Okay? We also have to collaborate with healthcare teams, work effectively in interdisciplinary healthcare teams, and promote safe and efficient care. Uphold professionalism, ethics, and accountability. Okay? This one, it will demonstrate integrity, ethical responsibility, and accountability in nursing practice. The purpose of this step is it ensures that nursing graduates are not only knowledgeable, but also competent in real life, operational, and measurable so that they can be taught, practice, and assessed effectively. It provides a clear standard to evaluate whether the program is truly producing the kind of nurses it intends to. Okay. The next step is developing learning outcomes per level. Year 1, apply basic concepts in simulated setting. Students begin with fundamental nursing knowledge and skills. We have this one, the fundamental nursing, in second and first year, second sem. The learning is often done in laboratory classroom and simulation. We already have our simulation mannequins for this one. And the focus of that is your anatomy, the physiology, and the basic nursing procedures and communication. In year 2, you have to provide safe care in a supervised practice. Students start participating in clinical setting now. In this level, they will be assigned in hospital settings. Emphasis on patient safety, proper use of nursing standards, and teamwork. Focuses bedside care, vital signs, patient hygiene, and basic documentation. When they reach year level 3, this is now the integrate skills in complex situations. Students handle more complicated clinical cases. They will now beginning to be assigned in wards with special cases, with multiple health problems. No, they begin to use critical thinking and clinical judgment in decision making. Focus to this level, apply evidence-based care, prioritizing intervention, managing emergencies. Year 4, the last year of our nursing course, is demonstrate leadership, research, and independent practice. Now they will be exposed to areas by themselves without clinical instructor. This is the final year students are prepared for transition to professional nursing practice. We have this one in your staffing and head nursing. Expected to function with greater independence, showing leadership and responsibility. Focus of this one is managing patients' units, conducting research projects, health advocacy, and preparing for professionals licensure. What is the purpose of the fourth step? It ensures that learning is progressive and developmental, from simple to complex. Prepare students gradually for independent practice by scaffolding their skills and provides a clear framework for course and clinical instructors to align their teaching strategies. Okay? The fifth step is to design the curricular structure. We have now to map the competencies into courses. Competencies is identified earlier are distributed into different courses. Each course should have both theoretical components, classroom learning, practical component, the skills labs, or the clinical practicum. Example, adult health nursing may include lectures to theory and hospital rotations in the practicum. Each course includes intended learning outcomes, a clear statement of what students should know or be able to do by the end of the course. Example, by the end of this course, students will be able to perform a comprehensive physical assessment. So focus on the competency, the special skills or professional value being developed, patient safety, communication, critical thinking. Teaching learning activities with this one is strategies used to achieve learning outcomes. Example, lectures, case studies, simulation, clinical rotation, problem-based learning, okay, or the PBL. Assessment methods of this one is tools to measure whether students achieve the intended outcome, written exams, OSCE, or the objective structured clinical examination, reflective journals, clinical performance checklist. Purpose of this step, it ensures that the curriculum is structured, systemic, and competency driven. Next slide. Align Aligning teaching strategies is the next step. Okay, use student-centered approaches. The PBL, student work in small groups to solve real simulated clinical problems. You give them problems, you give them patients with a clinical problem. It promotes critical thinking, clinical reasoning, and self-directed learning. Case studies also, learners analyze patient scenarios to apply theory to practice. It develops decision making skills, ethical reasoning, and integration of the knowledge. Simulation also is part of your sixth step. Uses mannequin, virtual labs, or standardized patients practice nursing skills in a safe, controlled environment. It also enhances confidence and competence before entering real life setting. Interpersonal education, students learn alongside peers from other health professions, encourage teamwork, collaboration, and respect to other healthcare roles. In community-based health projects, students now engage with communities to identify health needs and implementation and intervention. It strengthens public health nursing leadership and advocacy. The sixth step purpose is ensures the teaching methods are aligned with competencies and learning outcomes. Moves away from purely lecture-based instruction to active experiential learning. Prepare students to face real-world nursing challenges and confidence in adaptability. Okay. Next slide. Problem-based learning. Sample. Students are assigned a problem. Students identify. Then students learn to apply and solve. That is one sample. Parts of our nursing case study, information, health assessment, then finding and recommendation. This is part of our case study to be presented to HCI and San Pedro College. Okay, this is one sample also. The diabetes community based practice, guys. This is a sample of a uh, done by our student. Uh, Promoting health education to our patient. Okay. The simulation lab, as we can see, we have here the mannequin, the simulation room here, and this is our control room wherein uh you have to the students are performing the problem solving activity, and the CI will look at them in a secured room to monitor their progress. And the last picture here in our slide is the visual learning. Okay? Using a visual aid. Ito yung bago ngayon na ginagamit. Okay? So interprofessional teams, we also groups, healthcare professional working together, doctors, nurses, RTs, MLS, or the med techs, okay, social workers. We have to include the social workers also in the team. This is the work of a student again. Okay. The seventh assessment of competency, the seventh step. No, go beyond written exam. So you have to objective structured clinical examination or OCEs. We have also our checklist, our performance-based rubrics, portfolios, the clinical evaluation tool, and the capstone project. These are samples. This is your OCE. This is your nursing skills checklist. It shows a nursing skills checklist is structured to use in clinical practice. Okay. The next slide is our nursing care plan rubrics, no? When this image is a nursing care plan rubrics from West Coast University, designed to evaluate nursing students' ability to create and present care plan. We also have here a sample of our portfolio introduction page, likely part of a nursing student or professional academic. We are implementing that one now in our academe. So another is the evaluation form or checklist used in nursing education and training. It helps structure evaluate students. Okay. There are a lot of evaluation tools that we have. This image presents a step-by-step guide for creating a nursing capstone project. No, it's new to me. A capstone project, step-by-step, topic, literature review, the PICOT questions, the research methodology, data collection. Maybe the word here capstone is new to me. So this is my first time seeing a capstone project. So ang PICOT question develop a focused research question using the PICOT, the patient's population, the interventions, the comparison, the outcome, time. Example of that is the in elderly patient with hypertension, the patient education and diet. The I is compared to no education. The C, reduced blood pressure. Okay. So continuous curriculum review, the eighth step. The key elements of this one is the regular evaluation with feedback. You have to collect from different stakeholders to assess curriculum effectiveness. Student and faculty is one. Give direct feedback on teaching methods, course content, and workload. Clinical partners provide insights on how well prepared students are real clinical practice. Alumni is also part of our stakeholders and employers, indicate whether graduates meet professional and workplace expectation. Then update based on healthcare trends, the nursing curriculum must adapt to advances in medical science, new technologies, and updated clinical guidelines. Ensures graduates remain competent in rapidly changing healthcare environment. Example, adding content on telehealth, digital health records, or emerging diseases like your COVID. The purpose of the eighth step, it maintains the curriculum's the relevance, quality, and competitiveness. It also ensures graduates continue to meet professional competencies and accreditation requirement, provides a feedback loop for continuous development, making the curriculum dynamic instead of static. Okay. So curriculum design. Let's proceed to our curriculum design. That's all for your curriculum, the making of a curriculum and how to make a certain curriculum. So curriculum designs, we have two, the CBNE and the OBE. Curriculum design in nursing education especially focus in competency-based nursing and the outcome-based education. Here's the breakdown. Focus on CBNE and OBE, competency-based nursing centers on develop specific competencies, knowledge, skills, and professional attitudes that nurses must demonstrate in clinical practice. Learning is measured by performance, not just time spent in the class. The outcome based, on the other hand, focuses on the learning's outcomes students must achieve by the end of the program. Everything in the curriculum, the teaching activities, and assessment is aligned with the intended outcome. Okay, shaping knowledge, skills, and attitudes. The curriculum is not limited to theory but also emphasizes what? Number one is knowledge, nursing concept, medical science, and evidence-based practice. Skills, clinical procedures, decision-making, communication network. And lastly is the attitude, professionalism, compassion, ethical responsibilities, and leadership. We don't need a very theory-based skill or knowledge, perfect in theory-based knowledge, but poor in attitude. We also want a perfect student traits with skills, with knowledge, and attitude. The goals of our curriculum design is produce safe, effective, and professional nurses. The ultimate aim is to prepare nurses who are safe, deliver care that prevents harm to patients, effective, apply evidence-based and patient-centered intervention, and last one is professional, uphold ethical, legal, and compassionate standard in practice. The purpose of the to highlight that curriculum design in nursing education, it should ensure graduates are not only academically qualified but also competent, outcome-driven, and practice-ready. Okay, so competency-based nursing education and outcome-based nursing education. So in today's healthcare environment, nurses are expected to do more than just memorize information. They must be able to apply what they know in real life clinical situations, which are often complex and unpredictable. Okay, this requires critical thinking, sound clinical judgment, and adaptability. Sorry. For instance, recognizing the signs of a respiratory distress in a textbook is very different from identifying and managing it in a patient at the bedside. Because the picture of that one in the book is really different when you are in the clinical area. So it's why modern nursing education emphasizes competency-based learning and outcome-based practice. That ensures that nurses are not only knowledgeable, but also capable of delivering safe, effective, and compassionate care. Okay? We have traditional knowledge-focused models are very inefficient. CBNE and OBE emphasize practical competencies in outcomes. Okay. So focusing on the CBNE, the definition of this one is focus on demonstration of competencies, the knowledge, skills, attitude. Evaluate learners in real-world context. Frank et al. This slide is about competency-based nursing education, which is one of the key approaches in modern nursing curriculum. Here's the explanation. So CBNE focus where the demonstration of our knowledge, skills, and attitude. In CBNE, it's not enough for students to just know the content. They must be able to show what they can do in actual practice. Okay? So 70 key features. We have the key features based on CBNE. It highlights how CBNE differs from traditional nursing education. outcomes and performs in real context rather than just classroom learning. Competency focus, benchmarks for performance. Education is organized around specific competencies. These competencies serve as the benchmark or clear standards against which performance is measured. Example of this one, instead of just learning about infection control, student must demonstrate correct hand hygiene. Okay, so performance oriented clinical stimulation practice. Learning is tied to real world practice rather than theoretical memorization. Students gain competence throughout simulation lab, which we are doing now in San Pedro College, clinical rotation, our old style, and the focus is on application of knowledge and practice. The learner-centered mastery based on the progression, students progress by demonstrating mastery of competencies, not just by completing a set in class. It recognizes that learners have different paces. You have to shift focus from time-based education to competency-based progression. And the last one is the assessment-driven frequent evidence-based evaluation, when assessment is continuous, practical, evidence-based. Use multiple methods. Again, the OSCE, your direct observation in clinical settings, simulation, portfolio. Okay? So, core nursing competency of our CBNE, patient care safety, delivering safe, effective, and patient-centered care. Prevents errors, ensuring infection control, promoting well-being. The clinical decision-making and critical thinking, number 2, uses clinical reasoning and evidence to make sound judgment in assessing patient conditions, identifying problems. Example of this one, recognizing early warning signs of patient deterioration and acting promptly. If you've seen a patient suffering from dyspnea and seeing a sign or a symptom or a sign of clubbing of finger or not clubbing of fingers, um, bluish color discoloration of your nails, you have to do something with that patient because the patient is suffering from um, respiratory problem. Okay. Number 3, communication and teamwork. Effective communication with patients, families, and healthcare. Promoting collaboration and interdisciplinary teamwork. Evidence-based, the fourth one, practice, apply research findings. And the professional and ethics, upholding ethical standards, integrity, accountability of every action, and respect to your patient. Maintain confidentiality. You don't talk to the other staff nurses what's happening with that patient if you stumble upon something. And advocating for patients' right. If there is a wrongdoing done by your classmate, you have to prevent that one or you have to report. Leadership and management, the 6 core nursing competencies, leading healthcare teams, and managing resources effectively. The 7th core nursing is the health promotion and advocacy, promoting wellness and disease prevention at individual and community level. We're also advocating for policies that improve patient outcomes and healthcare access. Okay? So advantages natin of our and challenges. Advantage, practice ready, graduates, accountability lifelong, okay? Learning. CBNE has clear advantage. It produces practice-ready graduates and encourage lifelong learning. However, it is also has a challenge. It requires significant resources such as simulation labs, highly trained faculty, assessment are time-consuming, and it can be difficult to objectively measure qualities like empathy and compassion. Despite these challenges, the benefits outweigh the difficulty. So let's go to our outcome-based nursing education. OB is broader than CBNE. It focuses on aligning the curriculum instruction and assessment with clearly defined outcomes. In nursing, this ensures graduates are equipped with the right knowledge, skills, and attitude, just like your OCBNE, practice safely. The key is that outcomes-based the entire teaching process. Definition, learner-centered approach with curriculum outline aligned to outcome. So OBE principles, Clarity of focus. Teaching and assessment start with clear outcomes. Design down under, deliver up. Outcomes are identified first, and teaching is built around them. High expectation. High expectation, all learners are expected to succeed, though at different paces. Expanded opportunities. Students are given multiple ways and chances to achieve the outcomes. Okay? So levels of outcomes natin, we have OB strength include providing clear expectation, encouraging critical thinking, and promoting individualized learning. It also ensures accountability for both student and educators. However, challenges include heavy planning and documentation, a shift in the teacher's role from lecturer to facilitator, and difficulty in accessing attitude and values. Okay? Institutional level outcomes, general graduate qualities, program, nursing specific expectation, the course, subject specific goals, and the learning is lesson specific objective. Okay, advantages. This OBNE 7 is competency specific with a strong focus on practical nursing care, while OBA on the other hand is broader, excuse me, covering institutional program course and lesson outcome. So assessment in CBNE are based on clinical demonstration like OSCEs and checklists, while OBE uses rubrics, projects, and exams. So advantages, clear expectation, high order thinking, accountability. Challenges with OBE, extensive planning, teacher role, shift, difficulty, assessing value. So CBNE versus OBE in nursing. CBNE, competency-based, mastery-based clinical focus. OBE, broad outcomes, outcome-based, progressive general framework. Assessment, CBNE equals to SEE, checklist. OBE is equal to rubrics and the project. In summary, both CBNE and OBE put the learner at the center of education and ensures graduates are prepared for the real-world practice. CBNE focuses specifically on nursing competencies, while OBE ensures curriculum-wide alignment with outcomes. Together, they provide powerful strategies for producing competent, ethically practice-ready nurses. So CBNE and OBE emphasize student-centered learning and measurable performance. CBNE ensures immediate clinical competence. OBE ensures curriculum outline. Together, they prepare competent, ethical, practice-ready nurses. Okay, these references provide a scholarly foundation for CBNE and OBE, including works by Frank et al., Spady, Carden, WHO. They serve as guides and validation for the application of this framework in nursing education. So these are my references, and I may include our AI and also our Gemini Google Gemini. Thank you so much and have a nice day.